Let's now get you some COVID-19 updates, specifically the Omicron variant. Our correspondent Kalden Ongmu spoke to Dr Angelique Coetzee, the National Chair of South Africa's Medical Association. Now, she is the first doctor in South Africa who alerted authorities and the world about the Omicron variant. We asked her about South Africa's seemingly flattening COVID-19 wave and about the World Health Organization's warning that the Omicron variant is not mild. Listen in to this exclusive conversation.
Thank you so much for speaking to us, Doctor. You know, South Africa's COVID situation, especially this fourth wave, we've seen it coming down drastically, at least what the data has shown us almost every day. So what is the situation on the ground?
Currently, what we are seeing on the ground level is only very, very few patients still coming in with COVID-19 symptoms. Majority of patients seems to be well. We will see what is going to happen. The school started yesterday. And if it's still, our numbers are still low within the next 2 weeks, then I think we can say we are really, really moving now towards the end of the fourth wave with Omicron.
So, you know, the countries we've seen, like what we just spoke about, the fourth wave wasn't as bad as the third wave, you know, what the Delta variant did. So many people died and there was panic and chaos. What do you think that South Africa did right, and how did the country manage to flatten its curve?
I think there's two answers to this. One is, since the pandemic started, South Africa encouraged people to wear the masks. Even in between the waves, you would find it very difficult to go into any shopping center without your mask. So we kept on with the mask. We're still keeping on with big gatherings. We have for now, since the end of last year, stopped all restrictions on movement. So at least that's fine. And what we also that was to, again, ask people to go and get tested if they have symptoms. We try to get the symptoms out there to the public so that they understand when, or if what is, you know, how do they feel if they have this symptoms, to go and test. That's extremely important. And then we tried also to tell the doctors what to do. So we try to empower the people, with keeping in mind that the masks, that is extremely important. However, we still lack, especially in certain areas, on the sanitation part, which needs to really to be addressed by national department or by our government, as well as very important with especially with Omicron as well, in all the SARS-CoV-2 viruses, ventilation. So that's the one part of the answer. The second part is, I think what happens here is this is a very, very fast spreading viral infection. So it hits hard, and then just as hard as it hits, it sort of drop off with infections. It can also be that a lot of people, cause of the mildness of these symptoms, could have been infected, spreading the virus, so that there's a lot of immunity in the community without people knowing that. So that might also contribute. Remember, our vaccine rates are not the best that there is. It's about 45%. People are telling us that you have quite a younger population, which might be true. We have a younger population, but also remember, we've got a very high HIV and TB rate. And we also have people that are severely overweight in South Africa. And if you then compare that with the first world countries or other countries, they are very highly vaccinated again, especially for those people who are vulnerable to get severe disease. So so the severity of the disease should not be that high in other countries because of the vaccines, while we are less vaccinated. But still, we didn't see that number.
WION World is now available in your country. Download the app now and get all the news updates on the move.